I'm Dr. Kemp Clark. We're at the University of Minnesota Medical School, where I'm interviewing Dr. Ed Boldrey from the University of California for our archives of the American Association of Neurological Surgery. Ed, I know you're from Indiana. How did you manage to get to California?
Well, there was a place out there on the faculty when I finished my residency in Montreal, which, and you know it was there. And it came about because of the illness of another member of the Society of Neurological Surgeons who had gotten sick and had to resign. And this opened up a spot on the faculty, which was quite just in time for me. And some of my colleagues and former professors made the recommendations and the arrangements, and there I went.
There you went. What got you interested in neurological surgery anyway?
My basic interest in Kemp was in the nervous system. And this developed actually early in my medical school career. Is that what you want to discuss? Mm-hmm. I had not majored in biology or things of that nature in college. I majored in English composition. But when getting through with school, there seemed to be some other things that were going to be of greater interest. And it was possible for me to finally get into medical school. But I had a lot of things to take, subjects that I had not prepared for this type of approach. As a result, the first year was taken in 2 years. Oh. And as a result, I was able to take neuroanatomy and histology the first year out of college. In the second year, I got a job because these things were tight, and able to assist in those two courses. And in passing, picked up a Master of Arts degree because of some of the experimental work which was done, similarly related. At Indiana, the medical school was started in Bloomington, and then the last 2 years, as you may know, were in Indianapolis. I still needed money, and I got a job up there in the Department of Pathology because of this time in histology. But one of the things that they were interested in at the time was a book that had come out, and I'd been there a short time when the professor of pathology said, here, would you mind getting the brains out of the file there and look them over? Here's a book by a couple of Easterners, and maybe you can see if you can match them up. Well, the Easterners, of course, were Bailey and Cushing, and the job was to try to match up these gliomas. The third and fourth years, I was still needed a job. Most of us did at that time. And I got a job for the professor of neuropsychiatry for 2 years. And this was very interesting at the time. After having gone to Montreal, then at the Montreal General Hospital, Dr. Wilder Penfield and Dr. William Cohn came about the same time that I arrived there. I'd been there about a few years before, 2 or 3 years before. And things just fell in from there on.
So you must have arrived in San Francisco in what year?
I arrived in San Francisco in 1940.
1940.
That's correct.
And you must have seen an awful lot of changes in that city.
There have been a lot of changes in that city, as in most cities in the United States.
Yes. Tell me, you were, of course, a long time connected with the training program at the University of California. That must have been a very gratifying experience.
It was very gratifying. It really didn't get underway until after World War II. Mm-hmm. Dr. Howard Naffziger was the head of the Department of Surgery, and during those first years, the appointments were in the Department of Surgery. After the boards, of course, in neurological surgery were started about 2 years before I arrived there. And the board examination was taken then on the usual 2 years afterwards. Mm-hmm. The training program, though, was not well established, although Dr. Naffziger had trained a number of men. It was not well established until after World War II was over. Mm-hmm. And then a formalized training program was set up as the men interested got out of the service. During the war, Dr. Naffziger was a consultant to the Surgeon General, and was away, and my job was there, or left to be there and assist in the teaching of the undergraduates.
Can you tell me what you consider, what operation in neurosurgery do you like to do most? Or do you have a favorite operation?
Oh, I don't know that I have a favorite operation. I like to do almost any of them. I suppose that aneurysms and vascular malformations are a challenge. Abscesses, principally because that if you've accomplished what you aim to do, you have a patient who is likely to be able to carry on with a reasonable life and a functioning life. The tumors have been interesting and challenging, particularly the ones that have survived. The ones that are malignant are interesting, but they're depressing.
Do you have any particular operation that you don't like to do? Is there a procedure that doesn't attract you very much?
I don't know that I have any that at least we're coming along during this period of time we're talking about and the years following that I don't like. During these early years, we did a lot of sympathectomies for hypertension, and those were interesting because they're anatomical. No, I don't know of any particular operations I dislike.
What do you have any thoughts about the great advances which you must have seen in neurosurgery in this period of time? Can you know, like the use of the microscope and improved anesthesia and that sort of thing?
Well, I think the addition of the microscope, when it's properly utilized, has been a great addition. I think that there are times when it isn't necessary, when sometimes it is used. I think there are times when it isn't used when it should have been used. I think that the recent interest in the laser are going to be of very great significance to neurosurgery. And I rather envy young men coming along now who have this tool to work with, because it has a lot of promise, I think.
Yeah. What would you, or what do you tell, because I know the medical students seek you out, what do you tell them when they say, I want to be a neurosurgeon? Do you have any wise and sage advice to give them?
Oh, I don't know how wise and sage it is. That's, advice is easily given sometimes. I ask them what brought this up to their minds and why they think they want to do it. Along the same general lines, we ask medical students, why do you want to go into medicine? And you try to, all of us try to evaluate just what they have to say about their thoughts and reasons for that particular interest. And you, having had experience with them over the few years, you get to know just what the standard questions or standard answers are, and I think we come to, at least we think we come to know how to segregate one from the other, not always correctly.
Yes, that's quite true. Do you have, when you look at the Bay Area, which of course is probably the most lovely part of the United States in which to live, there are a very large number of neurosurgeons. Obviously, they elect to live there. I'm not sure that they can all make a living there. But does this have an impact on the training program at California?
I think that I think that its impact is not as much as you would think it would be, because because we get called on to consult with some of the neurosurgeons in practice outside. Many of our residents, I'd say even most of our residents, have stayed within a distance that they could refer patients for consultation, and they do. I think that it is surprising that this has occurred. Remember, there has been a tremendous increase in population, which has more or less gone along with the increase in the number of neurosurgeons.
So the neurosurgical ratio to population has really remained about the same, is that?
Not quite the same, but it certainly has remained as far as the university is concerned. Within potential percentage where the number of neurosurgeons seems to keep busy. I wonder sometimes about how busy what they're busy doing. And if you recall, some years ago, the board decided to investigate it more fully, the type of practice which was carried on in the first 2 years after finished formal training. And this was rather revealing, and some of the things that are being done are not what either you or I, or actually the physician, the neurosurgeon, had thought he would be doing when he got out of his training. With the advent of increased neuroradiological procedures, which have taken away some activities of the neurosurgeon, there has been a gap in neurosurgical activity, which I think has not been advantageous to either one.
I gather what you're saying is that with this increased number of neurosurgeons and with the decrease in their ability to do radiologic procedures, they may turn their hands to things which are perhaps not exactly totally appropriate. Does the volume of surgery reflect in your mind the number of people there are to do it? That, I guess, is another way of phrasing that question.
Well, the change is not as great as I would have expected. On the other hand, I think that there is some evidence that there is neurosurgery being done, which makes one wonder as to just what was the reason for doing that in the first place. And this does occur.
What do you think about the size of the institution in which neurosurgery should be done? You and I both know that neurosurgeons are moving into smaller and smaller towns. What do you think that's going to do in terms of the quality of care there?
I think that neurosurgeons, as a part of the profession of medicine, are going to have to develop their own philosophy, their own professional critique as to what they think they can and cannot do. And I think that this is going to have to be brought more and more to their attention, and not by the lawyers. I think this has to be brought by the profession to their attention, that this is a professional matter. We are a profession, a learned profession, and we and our colleagues, we ourselves as well as our colleagues, must not forget that. I think this is important.
I know you spent 6 years on the American Board of Neurological Surgery. You referred to the fact that you did the first attempt to determine something about neurosurgical workload. Who was on the board with you?
Well, no, that attempt was not me alone. We had the board participated in
Sure,
this.
I understand.
We discussed this, and yes, when I first went on the board, we had the 2-year practice period, but it wasn't really that well monitored. And I suppose that Don Matson and I we came on at the same time, and we got a chance to chat about it. And some time later, Harry Botterill came on, and we discussed things from his standpoint, from the Canadian side of the continent. And it was from this that we developed this matter of learning more about what was going on during this 2-year period by having the men bring in their results, their hospital results, with them at the time of the examination. And we thought this was a very valuable bit of information to have. Later on, as you know, also the written aspect of the training of the examination was set up, and I thought that had some help. It put aside a criticism that some of the men had said that they weren't all being examined equally, since some examiners were different in their approach to the examination than others.
I know everyone has their favorite board story. Do you have one?
Board story?
Board story. Like, for example, when I was an examiner, I questioned a young man once, and I was looking at his practice sheet as you were describing it, and I noticed that he'd done an inordinate number of myelograms compared to the number of cervical and lumbar discs he'd done. And so when my time to examine him came, I began to question him a little bit about the indications for myelography. And he looked at me and he said, "You're looking at my practice profile, and you see I've done a lot of myelograms and very few discs." I said, "Yes," and that sort of excites my curiosity as to why. And he said, "Well, it's very simple, Dr. Clark." He said, "I'm in a group of neurosurgeons. There are 5 of us in the group, and I'm the junior man. Guess who does the myelograms? Do you have any stories like that in your time on
Well, I have
board?
some that I don't think I'd care to tell right now. I guess the only one that I can tell was when I was examining for Bill German. At that time we were having half of our examinations in New Haven. And Bill German always liked to ask a historical question. So this chap who came along, and he didn't seem to have been quite too well versed in some of the phases of general surgery that Bill thought were appropriate, but he did think he'd try one thing at the very last that he was fairly certain that the man would know. So he said, as the man was about to leave, he said, "By the way, who was William Halstead?" And the man looked at him and he said, "Well, doctor, I don't know if I can tell you exactly, but I think there's a town in Kansas named after him." And we thought that that was confirmation that our original impressions were correct.
He wasn't too well grounded. Well, I'll have to tell you that you may not remember it, but you examined me on the boards.
Well, you smile at me, so I suppose you did all right. In fact, I know, of course, that you did all right.
I certainly did.
I know what you did, Kemp.
Yeah. Well, thank you very much, Ed. It's been a pleasure talking with
Well,
you,
you're
and I know
very
this will be a valuable record for us. Thank you.
You're very nice. Thank you.